I have a 35-year-old male, has a history of HIV, severe headache, fever, nausea, vomiting, altered mental status. Very nicely telling me that his CD4 count is 50. That is not good whatsoever. He has nuchal rigidity. Okay, so that already in like, all right, this is meningitis of some sort. They do an LP, which is great, and the CSF is analyzed with an increased opening pressure, low glucose. So low glucose means something is eating it. Bacteria and fungi are the two that eat glucose essentially in the CSF. Proteins elevated, and a lymphocytic pleocytosis. Okay, so then they tell me India ink staining of the CSF reveals encapsulated yeast cells. All right, yeast, thinking fungus here. So, which of the following caused this? All right, so Cryptococcus neoformans, totally a fungi, totally like an AIDS defining illness, and can present with all of this stuff. So, this is the highest on my differential right now. Neisseria meningitidis. It can't be this just purely because of the encapsulated yeast cells. This patient is presenting with meningitis or something along those lines. We also don't do India ink staining for Neisseria, so unlikely. Strep pneumo. This is not pneumonia. Yes, strep pneumo causes other things like meningitis, but that's not the most common. Listeria, again, entirely possible, likes to mess with the brain, but it's a bacteria, not a fungus. And Haemophilus influenza type B, again, not a fungus. So of the answer choices here, the only fungus I have is Cryptococcus, and I also have the additional that India ink is always associated with a Cryptococcus, as well as the super low CD4 count. So let's see if it is Cryptococcus. And it was.